you for joining us today. And on behalf of Screen New Jersey and the Rutgers Cancer Institute of New Jersey, hello and welcome to Community Cares and Project ECHO. Again, thank you for joining today's session, and we hope that the information shared today will help you serve your community better. And so just a few announcements before we begin the presentation. So if everyone can please keep your microphones muted during the presentation. Please enter all questions into the chat box and then we can discuss them at the end of the presentation. And just as a quick reminder, we are recording today's webinar. A quick disclaimer, so the information contained in this presentation is not a substitute for medical consultation. A physician should always be consulted for any health problem or medical condition. All logos, text, and images used in this presentation are the property of their respective copyright owners and are used here for educational purposes only. If you would like to use any portion of this presentation for non-personal educational use, please contact the meeting host or presenter for express permission. And here is today's agenda. We'll do the Project ECHO series overview. We'll introduce our presenters. We will have the didactic presentation and special topic, our case study, and then hopefully at the end we will have enough time for the question and answer forum. And a quick and brief overview about Project ECHO. So the Rutgers Cancer Institute became a Project ECHO hub in 2021. Project ECHO is a movement to demonopolize knowledge and amplify local capacity to provide best practice care for underserved people all over the world. The ECHO model is committed to addressing the needs of the most vulnerable populations by equipping communities with the right knowledge at the right place at the right time. And this is done by using technology to leverage scarce resources, sharing best practices to reduce disparities, applying case-based learning to master complexity, and evaluating and monitoring outcomes. And if you'd like more information on Project ECHO, please visit their website located on the bottom right of the screen. And now I'll move into introductions. I apologize as you're going to hear me speak a lot today as I'm actually presenting today. So I'll be doing the environmental and cancer risk presentation. And then we have Monica, if you would like to introduce yourself, she'll be doing the special topic for today.
Good morning, everyone. I am the tobacco cessation counselor for Rutgers Cancer Institute and with Screen NJ. Look forward to speaking with you.
Great, thank you, Monica. And then we do have Dr. Udasin who will be hopping on shortly and will be able to do her introduction before the case study. And so now for the presentation. So today's presentation will be on cancer and the environment. And so after today's presentation, I do hope that you will have a better understanding of the topic and how you can better protect yourself and your loved ones. And here is today's agenda. We'll do a general overview of cancer and statistics. We'll talk about the meaning of your environment. We'll touch on disparities. We'll discuss environmental risk factors, and then we'll talk about some risk reduction and safety measures. Okay. And then I have a pre-test here. I believe Evelyn will launch that. Thank you. So I'll give everyone a few moments, and Evelyn, just please let me know when we're ready to move on. Hopefully these questions are easy enough just to kind of give you something to think about during the presentation. Promise we're not grading anybody. We just like to see if the presentation that we do, resonates with people and if, they're able to take away the important information at the end.
I would say we're almost there, maybe another 30 seconds to a minute.
Okay, perfect. All right, I think we're good, it looks like. I will continue, thank you. Okay, and so just a quick general overview of cancer and statistics before we begin the bulk of the presentation. So what is cancer? This is a very basic overview of how cancer develops. So cancer is a disease in which some of the body's cells grow uncontrollably and spread to other parts. So normally these human cells grow and multiply to form new cells as the body needs them. And when cells grow old or become damaged, they die and new cells take their place. However, this process sometimes breaks down and abnormal or damaged cells grow and divide. And these cells may form tumors, which are lumps of tissue. And tumors themselves can be cancerous or non-cancerous, otherwise known as benign. And if the cancer is not caught early, cancerous tumors spread into or invade nearby tissues and can travel to distant places in the body. And that's through a process called metastasis. And this slide is about the incidence rate of cancer, and why we care is because the cancer burden is so high in New Jersey. New Jersey has a higher overall cancer rate of about 488 out of 100,000 people compared to the national average of about 449 people. And so this table here is just a screenshot of the incidence rates tables that you can actually find on the internet. Excuse me. And so you can actually go in, you can search by county, type of cancer, race, ethnicity, and you're able to see all the individual statistics for different burden and cancer sites all across the United States. And so this one was specifically for New Jersey. And I like this quote to begin the presentation, just because we know the importance of having a healthy environment and how it promotes human health and well-being. And so this quote by Ellen Richards says, "The environment that people live in is the environment that they learn to live in, respond to, and perpetuate. If the environment is good, so be it. But if it is poor, so is the quality of life within it." And so your environment, we like to think of your environment, people usually like to think, oh, it's just the place that you live, but it's also the place that you work. It's the place where you learn, where you play. This can be indoors or outdoors, so like neighborhoods or schools, universities. And essentially, it's the sum of all the living and non-living elements and their effects that influence human and daily life. And so now we're going to touch a little bit on disparities. And so although cancer incidence and mortality overall are declining in all population groups, certain groups continue to be at increased risk of developing or dying from particular cancers. And so in essence, they suffer more from cancer and are more likely to encounter obstacles in getting health care. And so this can be due to things like social, environmental, and economic disadvantages. And differences in cancer measures can be such as the incidence, so the number of new cases, the prevalence, the number of all existing cases, mortality, the number of deaths, etc. And then we have geographic disparities. So we know that 1 in 5 Americans live in a rural area, and New Jersey has about 9 million residents, and 10% of these residents live in rural areas. So when people usually think of New Jersey, I don't know, for those who are out of state, they don't realize that we're actually the Garden State. So a lot of our population, are farmers and do live in these rural areas. And so the cancer incidence rates, while they are higher in urban areas, so maybe areas closer to the cities, the mortality rates are actually higher in these rural areas. And that can often be because of delayed diagnosis. So let's say these symptoms go unaddressed for long periods of time because they have limited access to healthcare facilities, doctors, and resources, so screening and prevention services. And sometimes this can be associated with the lower health literacy in certain areas and a general mistrust of the healthcare system. And so these rural hospitals are often very limited in the number of services they can provide. So you would have fewer cancer specialists, such as oncologists, radiologists, pathologists, and surgeons. And often there is not enough funding, so revenue has continued to decline in these hospital areas. And sometimes it comes down to even just travel burdens. Let's say a patient may live greater than 60 miles from a healthcare system, or they can lack access to a private vehicle or public transportation. And then you have racial disparities. I won't read through the whole slide, but I think this is a great infographic to kind of give you a general overview. So for example, Black African American people have higher death rates than all other racial and ethnic groups for many cancer types. So specifically breast cancer in women and prostate and lung cancer in men. And just a few other examples, you have higher incidence rates of colorectal, lung, and cervical cancers in regions such as rural Appalachia. So this is just a good overview and just to kind of keep these statistics in mind when we talk about disparities. And so now we're going to transition into the environmental risk factors. So you have certain environmental exposures that can damage your DNA, which can lead to cancer. And some things are avoidable. So things like chemicals and tobacco smoke or radiation, but others exist in the air that we breathe, the water that we drink, the food that we eat, and even the materials we use to do our jobs. And so we want to understand, which exposures are harmful, where they're found, and how to avoid them if possible. Air pollutants. So the National Toxicology Program and the International Agency for Research on Cancer actually publishes a list of chemical substances that they identify as human carcinogens. It's not every year that they publish this, but I believe the most recent one was in 2021. So you can actually go online and just search it and you're actually able to find the entire list of carcinogens. And a carcinogen, again, is just any substance that causes cancer. And so while we say that a substance may be designated as a carcinogen, it does not necessarily mean it will cause cancer. Again, this can just be influenced by factors such as the amount and duration of exposure, or even somebody's genetic background. And then you have cigarettes and tobacco. We're actually going to go a little bit more into depth today about that during our special topic with Monica. And so everybody knows the harmful effects of cigarettes and tobacco smoke. That includes things like pollution, soil degradation, deforestation, adverse climate change, and biodiversity losses. And even the tobacco growers are susceptible to these dangers. So you have something called green tobacco sickness, which is an illness caused by the absorption of nicotine through the skin. And then, of course, you have the environmental tobacco smoke. So secondhand smoke contains more than 4,000 cancer-causing substances, and unfortunately, children and pets are particularly vulnerable to this type. And we have wildfires, which, if you've noticed, have been much more frequent and severe, if you've noticed in the news. So air pollution increases the risk of other respiratory diseases, for example, asthma. And the smoke from these wildfires includes harmful chemicals and carcinogens, so things like lead, arsenic, and benzene. And there have been studies to show that people residing within 30 miles of a wildfire actually have an increased risk of developing lung and brain cancer. And so this was actually extracted from some evidence that they found when they were studying firefighters who were exposed to smoke for long periods of time. And then transportation emissions. This, I feel like if a lot of people have, particular experience with. I know I do myself, being in certain parts of New Jersey. You can be stuck in gridlock and traffic, whether you're making, your daily commute. And so 20% of people who die from lung cancer every year have never smoked or used any other form of tobacco. And so that can mean, a range of different things. That can be due to genetics. It can be due to air pollutants, things in the environment, transportation. But we do know that heavily trafficked roads and sitting in gridlock raises the risk of lung cancer slightly because of the exposure to toxic fumes. And the NIH actually published a study that shows a correlation between the exposure to black smoke with lung cancer incidence. So this is actually a good thing just to keep in mind, unfortunately, when you're sitting, in traffic. And then we have carcinogens in the workplace. And so occupational exposures are actually where we usually find people are most highly exposed to carcinogens. So you have things like arsenic, which is in smoking tobacco, asbestos, which is found in insulation and fireproofing materials. And those are the little tiny fibers that are released into the air. You breathe them in and then they remain in the lungs for a long period of time. And so that can cause other issues like tissue inflammation, scarring, and that can also lead to breathing issues and serious health problems, things like mesotheliomas, which are the cancer of the thin membrane that lines the chest and the abdomen. Then you have things like benzene, coal tar, and coal tar pitch, and formaldehyde. And so the International Agency for Research on Cancer has actually identified over 120 agents that can cause cancer in various work settings. That's actually a little bit surprising. And then you have your agricultural chemicals. So this is, you often see the link between pesticides and cancer. So you can see that there is such a diverse group of chemicals that people use to control pests, plants, molds, and insects. And they're not only used in agricultural and commercial settings, but even in residential settings. So there's a statistic, I think, that talks about the risk for home and lawn owners who use gardening chemicals every year. And it's about, I think they say about 80 million pounds of synthetic pesticides that homeowners use for their lawns every year. And so we do know that there are some adverse toxic effects for humans. They have glyphosate, which is actually an active ingredient in Roundup, which is a probable carcinogen. And so exposure to that can be associated with endocrine disruption, organ damage, and even birth defects. And then there was a very interesting study that was done that shows that the majority of the US population actually had detectable levels of pesticide metabolites in their urine. So that can be from things like maybe the ingestion of the food that we eat, if that's treated with certain pesticides, and maybe just other indirect exposure routes that we're not quite aware of just yet. And then Superfund sites. So a Superfund site is actually a location polluted with hazardous materials. So it's an area that's heavily contaminated. And I like this graphic here because it gives you a good idea of Superfund sites that are actually located in New Jersey. So while we're relatively, a smaller state, we can see that there are a decent amount of Superfund sites just within this area. And so thousands of these sites are due to the hazardous waste being dumped, they're left out in the open, or they're improperly managed. And so these can be from manufacturing facilities, processing plants, landfills, and mining sites. And they release toxins that can increase risk of several types of cancer. And for those people who are local, I don't know if you're familiar with the Toms River, New Jersey case, where there was actually a cancer cluster among children. And that was due to the chemical corporations dumping toxic substances into the waterways and burying almost 50,000 drums of toxic waste into the ground. And so there has been lawsuits over the years, and there's tons of information out there if you're interested in researching that. And even in our own homes, you are exposed to chemicals. So chemicals entering the water supply that can cause contamination, things like arsenic and asbestos, radon. And arsenic itself has been linked to cancers of the liver, lung, bladder, and kidney. And while chloride is used for water treatment, they can actually cause other issues. It's actually been associated with increased risk of bladder and rectal cancers. And then even in your household products. So things that you use to clean that can often contain harmful chemicals that can increase cancer risks. So it's always important to use and to dispose of these products carefully to minimize your risk. So this chart here, the top margin actually shows the number of products with each chemical that's routinely used in the home. And the right side shows the number of chemicals in each product. So this was just a good graphic just to kind of show you that these chemical exposures and these cleaning products are actually very common, and that the majority of people in their homes do use these things. Radon. Radon is the second leading cause of lung cancer in the United States after smoking, which I actually thought was very surprising. And this infographic here actually shows a potential radon potential map in New Jersey. So as you can see, there are areas that are considered tier 1, which have high radon potential, all the way down to tier 3, which have low radon potential. And so radon is actually a radioactive gas that has no smell, color, or taste. And it's actually produced from natural radioactive decay of uranium that can be found in all rocks and soil. And so it actually escapes from the ground and is released into the air. And so if you've never, had experience with radon, it's always good to have your home tested, especially when you're preparing to buy or sell before and after any renovations, like converting a basement to a bedroom, for example. And then you can actually go and buy your own radon test kits. They have ones that are short-term and long-term. And for example, if you do find yourself with a radon level between 2 and 4 PCI per liter, it is good to contact a professional and they will actually install a radon reduction system. And sun exposure. This one I feel like is overlooked because people don't usually think of it. But sun lamps, and tanning beds all give off ultraviolet radiation. And so this can cause, early aging of the skin and damage that can eventually lead to skin cancer. And people of all ages and skin tones should limit the amount of time they spend in the sun, especially those that are in certain occupations, such as agricultural workers, construction workers, first responders. And so some precautions that you can take will be, wearing sunscreen with a sun protection factor of at least 15 to 30, wearing wide brim hats, long sleeve clothing, and even sunglasses just to keep your eyes protected. And so now we'll discuss a little bit about risk reduction and safety measures. So we want to do our best to minimize the impact of exposure. And this could be by avoiding excess sun exposure, making sure that you're following industry safety standards, wearing personal protective equipment, especially at work, avoiding secondhand smoke when you can, and even using a safe water supply. And mitigating carcinogens. Again, checking levels in your home. You can buy things like a radon monitor. Even carbon monoxide monitors are usually installed in homes. Asbestos testing in your homes, school buildings, work offices. And again, just following safety instructions when using, storing, and disposing of harmful materials or chemicals. And this is just some general guidelines for product disposal. So you always store certain products in regular sealed containers and in covered areas. You never combine any products and you never pour any products on the ground or down storm drains. So the safest option is to always dispose at a local hazardous waste collection facility. And so this was a good example because there's actually waste disposal sites all across each state and they usually go by county. And so this one was specifically for New Jersey. So you can actually go online, you're able to search and you're able to find a local hazardous waste collection facility right in your own community. So that brings us to our post-test. Evelyn, if you don't mind putting up those polls for me. Thank you. And then we can go over those questions once we have a good number of participants. Looks like we have a
Okay,
good
we just
number.
need a few more people to finish the poll and then we are good to go.
Great, thank you. Perfect. All right, it looks like we're hovering around, most people having participated. Great. So it looks like everybody did actually very well. So the first question, New Jersey has a higher overall cancer rate than national average. That is true. We did talk about the cancer burden in New Jersey and how it is high. The second question, exposure to chemicals such as radon or asbestos can damage DNA and lead to cancer. That is also true. And the third and final question is it is safe to dispose of chemicals down storm drains? And that is false. Again, we talked about disposing of chemicals properly or even finding your local waste facility. And so now I will transition into our special topic, which will be presented by Monica.
Thanks, Gabby. A lot of great information. Good morning, everyone. So today we'll be talking about environmental tobacco smoke and what it actually is. We'll briefly discuss first, second, and third-hand smoke. Next slide, please. Just off the bat, no safe levels of secondhand smoke is safe, not at all. 1 hour of secondhand smoke exposure is equivalent to someone smoking 4 cigarettes themselves. Let me repeat that. Being exposed to secondhand smoke for 1 hour is equivalent to smoking 4 cigarettes yourself. Secondhand smoke, as we know, it is what's exhaled and breathed out by the smoker. And this can be from cigarettes, traditional combustible cigarettes, and also from our vaping products. So if you're in proximity to someone who is vaping, you will also receive that secondhand vape smoke and secondhand tobacco smoke. You could see the illustration here. You could be in the same home with someone who's a smoker, and they're thinking by being in their room, closing the door, doesn't expose the whole family, but it actually does. The smoke travels through vents and it travels under doors and it can penetrate the whole house actually. And just so we all understand why we talk about secondhand smoke being as no safe level, we have data from 1964, 2.5 million individuals have died from secondhand smoke. 2.5 million individuals. So think of all the kids that grew up with parents that were smoking before all the PSAs were out, before we were really educated about secondhand smoke. So this is why we urge people to please don't expose yourself to secondhand smoke. Next slide, please. When we talk about the residue, we're talking about third-hand smoke, and most people have not heard of third-hand smoke. Third-hand smoke is what can be left in your clothing, your hair. Just think of someone smoking in their car and not having any passengers, and later on having passengers in that car. Those individuals will be inhaling the same chemicals long after the tobacco product is no longer in use. We know that third-hand smoke can last from anywhere to weeks and to months on surfaces. Think of your upholstery, your furniture. We do know with data that third-hand smoke is very susceptible to pets and children. Think of the small objects that kids like to put in their mouths as they crawl on the floor. So any of those chemicals that are sticking or binding to the furniture, to the surfaces, which could be some of the carcinogens that Gabby did discuss, we're talking about arsenic. We're talking about formaldehyde and lead. These are toxic, poisonous chemicals that remain on surfaces long after that smoker has parted. And it's not just from a vaping product or from a traditional combustible cigarette. If you look at the illustration here, we're talking about hookahs, we're talking about pipes. Anything that produces smoke can leave the residue of a carcinogen. Next slide, please. We did touch with Gabby's presentation about the environmental contamination. We were lied to back in the 1950s and 60s about the harms of tobacco smoke. And also what they told smokers is that the filters were what kept most of the toxins from penetrating someone's lungs. Unfortunately, that filter did not do that, and they even stressed that the filters were biodegradable, which has become absolutely false. None of these products are biodegradable, and the plastics that they're made of do not break down. So they seep into the soil, the water, and contaminating the environment. And I know a lot of people are very active with the environment and very concerned about the earth that they're leaving behind for future generations. But we have to understand that not every state is aware of the dangers of environmental contamination. Some states are doing better than others. So just be aware, like nicotine can get into the groundwater. It can turning into microplastics. And what that does is allows many of like our fish, it could get into the water, all of our seafood. So those I guess what we could say, what feeds humans, what they're feeding on is what we would get indirectly. So definitely we want to just be mindful. Like none of these products are disposable, even though they say that they are disposable. Next slide. Yes. Yes. So these are some quit services. Thank you, Gabby. These are some quit services in the state of New Jersey for anyone who has been touched by not wanting to contaminate the environment to absolutely get help to quit. Next slide. And I just wanted to show everyone what we can do to better safeguard our health, especially if you're someone who has lung disease, prone to immuno issues. You can check the air quality and it'll tell you exactly, as you can see, I had checked the air quality for New Brunswick. That was a while ago. I was doing a presentation to show people that there is a site that you can check to get the air quality to understand what you're being exposed to. And as you can see, it tells you the carbon monoxide, sulfur dioxide, and nitrogen dioxide levels. This is just to help keep you safe. If you have a loved one that may have emphysema, COPD, lung cancer, or any immunocompromised individual, this is just a great tool to help safeguard your health a little bit further. And I believe that's it. And this is my contact information if you'd like to get a little bit more information and keep in touch. Thank you, Gabby.
Great. Thank you so much, Monica. Apologize. Looks like my mouse got away from me for a little bit, but thank you for the great information. So if you have any questions, please feel free to drop them in the chat and then we can discuss them at the end of the presentation. So now I will turn it over to Dan, who's gonna hop on and talk about our Stride dashboard. I'll give it to you, Dan.
Oh, thanks. I appreciate it. Hi, everyone. So I'm Daniel Pearson with the Cancer Health Equity Center of Excellence at Rutgers Cancer Institute. And I do the catchment area data and surveillance, and we built a really neat tool called Cancer in Focus that has been a collaborative effort across some of the other NCI designated comprehensive cancer centers. So on this dashboard, we include some environmental risk factors that are mappable and also downloadable. So some of the things we include by county and also by census tract, we have air toxics, respiratory hazard index, annual ozone average, diesel particulate matter, hazardous waste proximity, lifetime cancer risk from air toxics, particulate matter, Superfund and risk management plan facility proximity, and then we have toxic releases to air, toxic water discharge, traffic volume, and underground storage tanks. And then we also, on those maps, have the ability to plot the Superfund sites that Gabby had shared the slide of. So you can add those points to like a chloropleth colored map. And those points are also interactive, so you can hover over them or click on them and it'll give you the information about the site, the address of the site. And we also have toxic release inventory facilities that you can plot, which also gives you the same information. So it'll give you the facility name, where it's located, and also what chemicals are released. And we're working on a future update for the dashboard right now that would include the air pollutants from the National Air Toxics Assessment from the US EPA. So they have available by both county and census tract like hundreds of air pollutants that they track by ambient concentration and lifetime cancer risk. So we're looking to add those onto that dashboard as well. And I think Evelyn just put the link to that Cancer in Focus platform in the chat. So this one is for New Jersey only, since we do only cover New Jersey cancer here. But if you're located proximal to one of the comprehensive cancer centers, they may also have one of these dashboards already built out. So you can definitely check in with the cancer centers that are nearest to you to see if they have one. Yeah, but I wasn't expecting to speak, but yeah, thank you for the time. I do appreciate it. I think there's some more links and info going in the chat. And if anybody needs to reach out to me, you can feel free to just shoot me a chat in here for the rest of the session or reach out to me on the side. Thank you, everyone.
Perfect. Thank you, Dan. I know you were kind enough just to join us for a few minutes, so I apologize that we don't have any slides, but the information and Dan's information will be in the chat, so feel free to reach out to him or if you need any other information. And so we do actually have a few questions for Monica if you're available to answer some. We have some coming through the chat.
Sure.
Perfect. So Evelyn, if you want to go through some of the questions that we do have.
Sure. So Monica, both the questions have to do with secondhand smoke. Is there an echo? Do I sound a little wonky? Okay.
You sound
Maybe it's on my end. Can you discuss more about secondhand vape and what the health impacts are? Is that still like smoking for combustible products? That's the first question. First part one, part two question.
I'll answer part 2 first because we know that some vaping products, they have advertised that they can give you 200 puffs. They can give you 1,000 puffs. So it's hard to count puffs to equate it per cigarette. It depends on the person's rate of puffing, how deep they puff, and how often they're puffing. So it wouldn't just be 1 puff, 2 puff, because it could be a long drag, which could be more than 2 cigarettes. So the information is still not 100% clear on vaping. But what we do know is that most of the chemicals that we find in combustible traditional cigarettes are also found in some vaping products. For instance, arsenic, lead, and formaldehyde has been found in vaping products. So if you are in proximity to someone who is vaping and they are exhaling in your presence, you are getting that secondhand vape. As we know, the data is still not really confirming what the health hazards of e-cigarettes are, but we do know some of the same chemicals are found in traditional tobacco. So it's just a matter of time when we get the data to really know what some of the health effects are.
Thank you. And then for the second question we have, is there any data around secondhand smoke exposure and cancer prevalence in people with disabilities? And then also they're asking about exposure from caregivers.
We do know anyone who's immunocompromised. Now, disabilities can mean different things, but if we're thinking of anyone who's immunocompromised, you are definitely more susceptible to getting an illness that is caused by secondhand smoke. If you remember in one of my slides, we have data that shows from 1964, we know since 1964 to present day, 2.5 million individuals have died of secondhand smoke.
Monica, I have a question. I know you touched upon it briefly with the actual detritus that we're seeing from like the vapes and the cartridges and the machines. I remember as a child that, people used to, I don't see it as much now, but I remember as a kid, people would throw their cigarettes, their ashtrays, their packs out the windows of cars. You don't see that as much anymore. But are you starting to see like more of the vape components in odd areas or like just seeing it where we shouldn't really be seeing it? I know you touched upon it.
They're everywhere. Even in, like, we know on sidewalks, if you look down, you'll see all the disposable products, like you used to see the cigarette butts. Because they're quote unquote disposable, which is a misnomer, they throw them on the floors in buildings. You'd be surprised, like you're walking around, you're like, you couldn't just throw that into the garbage can that's a couple feet away. So we've seen them everywhere. It's just everywhere.
That's a shame. That's a real shame. You know, we worked so hard to clean up everything. The littering, you know, that kind of, it feels like it's a throwback to the 70s.
It is, and that's why we're trying to especially speak with the youth who are more so environmentalists, and to give them that knowledge to really understand, if you're an environmentalist, you should also be thinking about how do we control the disposing of these e-cigarette products.
And what is the proper disposal? Can they just be thrown in garbage? Because I when I think of it, I think of like batteries and like all those heavy metals, all of that stuff. Does that just go into a regular trash can, or
Regular trash
should
can.
they go into a regular, different receptacle?
No, regular trash can. As a clinician, if I had my way, it would be a different receptacle. As a matter of fact, Evelyn, people are throwing batteries away now, and it's okay to throw them away, that you don't have to put them in a separate container anymore. But if I had my way, I would definitely have a separate, like, you know, we have the recycling for plastics. I would have a bin specifically for e-cigarette products or non-combustible tobacco products.
Hmm.
That's what I would like.
And then, right, a hazard to our dogs, pets, people drop them all over the sidewalk. And I mean, I don't know, I have a beagle. Beagles put everything in their mouth. They're like a 2-year-old. So yeah, it's really scary when, especially if it has like some kind of a flavored vape or something where it might be enticing to a pet to
Mhm.
pick up. You know, I didn't really think of that, but that could cause a lot of damage too.
Yes, that's why one of my slides, when we talk about the residual smoke, the third hand smoke, what we know, kids and pets are more susceptible to to exposure because they're close and lower to the ground or the floor, and they love putting things in their mouths. And especially, you know, your pets are always sniffing, always smelling and licking. So they're definitely getting exposed to those harmful chemicals.
Awesome. Thank you, Monica. I actually even just had a question kind of going off of that. I know a lot of people, even when they give presentations, they'll often ask, oh, is vaping safer than cigarettes because they do contain all of those different chemicals? Or I hear a lot of the youth talking about that. And they say, well, it's not the tobacco, it's not the nicotine. Is that necessarily true? Is there enough research information on that quite yet? Or
What we have research on is that, you'll hear me say this if you've ever heard my presentations, is that if adults are using e-cigarettes the way they were intended to be used, they may help with the smoking cessation component. But just because something causes less harm doesn't mean it's completely harmless. So that's what I would say. And the data has not been collected. It hasn't been enough time for us to see the long-term health effects of using e-cigarettes, but definitely there are less chemicals in smokeless tobacco than there is combustible tobacco. But again, just because something may cause less harm does not mean that it's completely harmless.
perfect. Thank you. I know that was a big question that always comes up. So I feel like that's something that, is great to even just do a separate presentation on, especially in schools, even universities. Thank you, Monica. Any other questions if anybody does? Feel free to unmute yourself. I know unfortunately Dr. Dassin is actually caught up with some patients, so we're trying to be patient.
Gabby, what about, I know in the news recently where I live anyway, a couple of years ago, we had some issues with PFAS in our water. Have you seen or come across any other stories like that where, or how they affect us?
I have a little bit, definitely, especially in New Jersey. I would say even, I guess a long time, or not long time ago, but the issues that 3M was having, where they were disposing of things into the water and stuff like that. But they have definitely seen correlations between that, or even there was one area particularly where they couldn't even sell their houses or their homes real estate wise because of what was in the water and in the soil. So that's definitely something to be aware of that. And she brought up a good point as well that what they were trying to do, they were trying to, remediate those areas. But is it just as dangerous to go into the soil and, kind of dig up all of those chemicals that have been lying there for years? Or is there a better way to, repurpose the soil and the water in that area instead of doing that? And so there's a lot of research going into that. So I think that's something that's very interesting and that, we should definitely be looking more into.
And Monica, we have another question for you. What is the rate of danger with smoking hookahs?
So hookahs are another form of smokeless tobacco, and hookah lounges are popping up all over the country. We know we have a nice amount here in New Jersey. A 45-minute to 60-minute session of hookah is equivalent to smoking a pack of cigarettes. And again, it goes with how deep someone inhales and the flavor. I've said before, anything that has a flavor cannot be broken down in the airway. Flavors are for baking, for cooking, like the cherry, the cinnamon, all of those nice flavors that they do put in the hookah. When you're inhaling, and it depends on the individuals, how deep you inhale, and you may have it deposited even deeper into your lungs. And we do know a lot of the same chemicals that are found in e-cigarettes are also found in hookahs. So I hope that answered the question in terms of the general exposure and what that can do to your health.
Wow. I do have another question for Gabby. Gabby, can you tell us more about how household products can affect our health, even when we're using them properly? For example, cleaning products in well-ventilated spaces, using non-chemical based cleansers.
Actually, that's what I was going to say. Even just, trying to be in better ventilated areas, maybe even, wearing a mask when you're using certain products. Try to keep yourself from being exposed for long periods of time. I know even with myself, I notice that even if I'm cleaning with something strong like bleach or Lysol, anything like that, that even I feel the effects after a while. Sometimes I get a headache, my nose, my throat gets very sensitive. So I'm always careful not to be in that area for too long. I'll definitely open a window or a mask. But definitely there's been that big push towards people using greener products. And they've definitely come across the market. They're very, very popular. So that's something I would definitely, if anybody else has any cleaning tips that they have, feel free to share them because I think that's something that we could all definitely use. But I guess, is that it for questions? It looks like that. Well,
Oh,
I-
one more. What efforts are currently underway to raise awareness about disposing hazardous waste among communities facing barriers such as getting to their local waste sites?
Actually, that's pretty interesting because I actually don't have that much information on that. I feel like that's something that I didn't come across too much, and I feel like there has to be greater awareness about that. Even with, personally, I didn't know that there was a local hazardous waste site like in my own community. I thought it was going to be several, towns away, but they're actually a lot closer than you think. And so, I think there definitely has to be, some type of campaign or awareness that goes around regarding that. That's a great question. Thank you. All right. Well, it looks like, let me see. So it looks like Dr. Dawson actually got caught up with a patient. So I apologize, everyone. We'll have to hopefully give you guys the slides regarding that later on. So in the meantime, I'll just give you guys some information about our patient navigation team. So at the Rutgers Cancer Institute, New Jersey, we are committed to meeting the cancer-related needs of communities across the state. Our patient navigation team is here to help guide you throughout the cancer continuum by assisting with healthcare access and coordination, focusing on patient-centered care and communication, and coordinating appropriate and timely screenings. Then we have our New Jersey Cancer Education and Early Detection, so NJCED. So interstate, we have NJCED, or the New Jersey Cancer Education and Early Detection Program. And it's a program run by the New Jersey Department of Health in collaboration with local agencies and healthcare systems. The New Jersey Seed program provides education and outreach within the community about different types of cancer. They provide free screenings to those that are unemployed, underinsured, uninsured, or face barriers to getting the cancer screenings they need. The New Jersey Seed program currently provides screening for breast, prostate, cervical, and colorectal cancers, and the program is offered in all 21 counties throughout our state. And so that brings us to the end of today's session. Thank you again for attending, and if you could please use the link or this very quick and easy QR code just to let us know how we did. And I believe Evelyn will also be dropping it in the chat as well. So if you guys could please fill that out for us, let us know things that we can improve on, topics that you would love to see in the future. And then we do have our Mighty Networks community where we will be posting all of the resources and materials from today's presentation. So we do usually ask that you give us about 2 weeks for the recording and the resource finalization. But if you head on to there, if you register, you are able to communicate with other people that have similar questions, or are able to engage with each other and things like that. And then our RPF is actually open. So if anybody has any questions, please feel free to unmute yourself. We have some information here regarding the partnership opportunities for the 2024 fiscal year. I don't know if Evelyn or Ellen, if you guys have any more information regarding that.
I can pop in. I just wanted to share that this is available to all partners in New Jersey. So feel free to attend some of the info sessions. I think those are being dropped in the chat for availability to sign in. But if you have any questions, immediate questions right now, you can drop them in the chat.
Wonderful, thank you. And then coming up, we do have our microbiome presentation in April. So feel free to register here. The link will also be dropped in the chat. And we do really hope to see you there. And again, we really appreciate your attendance. And if you need any other information, please reach out to us. You can email us, you can give us a call, or even just check out our website. Thank you, everybody.
Angelica, if you already registered for this, you should have it. You'll get the reminders when they pop up. Angelica.
On my email?
Yes, if you've already registered, since you're here, you've registered.
Right.
So you'll be getting the reminders for the next session.
And that's at 11, from 11 to 11:30?
It will be from 10 to 11:30 on April 10th.
Oh, okay. Sorry. I thought this was until 11:30. I just got that email.
We're finishing up a little early today.
Okay, okay, thank you.
Thank you. You have a great day.
You too.